Anxiety and depression can affect anyone, including kids and teens, especially during times of transition like going back to school. Kentucky Children's Hospital psychologist Alyssa Briggs discusses how anxiety and depression in kids can show up in ways parents might not recognize.
You usually see kind of some of this hyperactivity and fidgetiness you might expect with ADHD, only, ADHD kind of is part of development, whereas anxiety comes on all of a sudden, right? So that hyperactivity and fidgetiness might be something new. Another common thing you see with anxiety is difficulty sleeping. So if all of a sudden we're having a hard time falling asleep because our thoughts were racing, or, we seem really tired, or like we haven't slept well, that may be a concern. And then, the go-to thing to do with anxiety is to withdraw from what you're afraid of or avoid it, right? So if we see, withdraw from school, or withdraw from social things, or withdraw from clubs, or refusal to go places, refusal to talk to people, right? Then you might be concerned about anxiety. There are two signs, I think, that are very different, and one is noticed and one is not. So the sign that we're used to is, somebody who's sleeping all the time, not interacting, isolating themselves in their room, just kind of seem like very lethargic and slow. The other sign that we are not used to attributing to depression is acting out. So, sometimes when kids feel like they don't have any hope for the future, they may go out and do high-risk things with their peers. They may be more irritable and explosive at home and be getting in more arguments and fights because, the stress response system either has us freeze, fight, or flee. And a lot of times, the fight behavior is so obnoxious, we forget to think about what might be going on underneath. What we see in mental health in kids is that, younger kids may express more anxiety, and those same kids without treatment may develop into older kids with depression. Anxiety and depression are very, interrelated in the brain. They can occur at the same time. So I think, if you're seeing signs of one, you really should question and look for signs of the other.
Try these mindfulness resources to manage stress and anxiety.